What if I told you the most dangerous time for your heart is often the moment your alarm clock rings? Act fast. Act now. If you wake up with chest pressure, shortness of breath, sweating, or a crushing discomfort in the center of your chest, especially this morning, these next words could matter. If this is happening right now, call 911 immediately. Say clearly that you think you are having a heart attack. If you are not allergic and your clinician hasn't told you otherwise, chew one adult aspirin. Chewing is faster than swallowing whole tablets. Sit or lie down and try to stay as calm as you can. Tighten and strain increase oxygen demand. Take nitroglycerin only if you have been prescribed it before and you know how you've been instructed to use it. Do not drive yourself to the hospital. If you become unresponsive or stop breathing normally, have someone start CPR right away and use an AED if one is available. Bystanders, make sure the scene is safe, call emergency services, and begin hands-only CPR if the person is unresponsive and not breathing normally. Push hard and fast in the center of the chest. These actions, taken in the first minutes, can change outcomes. If you find this useful, tap like and share. This could save someone's life. Take a breath. I know these steps feel stark, but they are simple and proven first responses. Now let me explain why mornings are uniquely risky and what you can do to reduce that risk tomorrow and every morning after. Your body follows a clock. In the pre-dawn and early morning hours, many hormones surge. Cortisol and adrenaline climb up to prepare you to wake. That's helpful for getting out of bed, but it also tightens blood vessels, raises heart rate, and increases the tendency of blood to clot. At the same time, you wake relatively dehydrated after several hours without fluids, and your blood can become slightly thicker. Think of it like ketchup that's been sitting in the fridge, more viscous, more likely to stick. Platelets, the tiny cells that make clots, act like Velcro in that early morning surge. They are stickier, so a small tear in a cholesterol plaque is more likely to plug up the artery quickly. This combination, vascular constriction, thicker blood, stickier platelets, is the so-called dawn phenomenon that raises the chance of heart attacks, strokes, and sudden cardiac events between roughly 6 a.m. and noon. Inside an artery, a cholesterol plaque can behave like a crack in a dam. During the early morning rush, that crack can widen just enough for blood to contact the raw surface. The platelets and clotting factors rush in, and suddenly a clot blocks the artery. When that artery feeds the heart muscle, you get an acute myocardial infarction, a heart attack. The good news is that rapid action by you or someone nearby, calling emergency services, having aspirin within minutes, and getting professional help can limit damage and save lives. That's why act fast. What to do if you have a heart attack in the morning is not just a title, it's a plan. There are 5 morning signs people often dismiss. If you notice any of these, especially 2 or more, call your doctor and consider urgent evaluation. If any of them occur with chest pressure, shortness of breath, lightheadedness, or cold sweats, treat it as an emergency and use the steps I listed earlier. First, a new or worsening helmet headache or intense morning head pressure. Not every headache is a heart problem, but waking up with severe pressure, particularly if accompanied by high blood pressure readings or visual changes, can be a wake-up call for cardiovascular risk. Second, unrelenting morning fatigue or a sense of being wiped out despite a full night's sleep. If you regularly find you cannot get going in the morning beyond normal tiredness, your heart or sleep quality may be signaling trouble. Severe fatigue with shortness of breath on light exertion deserves prompt evaluation. Third, loud snoring or witnessed pauses in breathing during sleep, suspected sleep apnea. Sleep apnea repeatedly disrupts oxygen levels, raises nighttime blood pressure, and makes morning surges of stress hormones worse. Loud, witnessed gasping or choking episodes at night are a red flag. Fourth, morning nausea or indigestion that feels different, persistent, crushing, or accompanied by sweating. Many people discount this as acid reflux or a bad breakfast, but for some patients, the first signs of a heart attack present as gastrointestinal discomfort, especially in women and older adults. Fifth, facial puffiness or unexplained swelling, particularly around the eyes, or sudden swelling of the legs. While not specific for an immediate heart attack, these signs can indicate fluid retention and early right heart strain. If swelling appears suddenly and you experience breathlessness or chest discomfort, seek medical help. One warning sign means pay attention. Two or more, that raises the urgency. If any of these occur with chest pain, pressure, lightheadedness, fainting, sudden shortness of breath, or cold sweats, follow the emergency checklist now. Let's move from emergency steps to prevention you can do each morning, the cardiac safety protocol I recommend in my clinic. First, immediate hydration. Keep a glass or bottle of water at your bedside and drink a few sips before you get up. After hours of sleep, your body is relatively dehydrated. That thicker blood can contribute to morning clotting. Hydrating gently helps thin the blood and lower the strain of sudden standing. Second, the 120-second rule. When your alarm goes off, don't leap out. Sit up slowly and wait for about 2 minutes. Count it out. Swing your feet to the floor, take a few deep breaths, stretch your arms overhead, then stand slowly. This gives your circulatory system time to adjust and reduces the risk of sudden blood pressure shifts and falls. For older adults or people on blood pressure medications, this small delay can dramatically reduce dizziness and orthostatic risks. Third, thermal protection. Cold exposure stiffens blood vessels and can trigger a harmful surge. Put slippers on before standing on a cold floor. Avoid stepping into an icy bathroom or taking very cold showers first thing. If you bathe in the morning, warm water and gradual temperature change are safer. Food and drink choices matter. A breakfast heavy in refined carbs or added sugars can produce a quick spike in glucose and insulin, stressing your blood vessels. Instead, aim for protein and fiber within the first hour. Examples I suggest: eggs with whole grain toast or avocado, or a bowl of oats or chia pudding topped with berries and nuts. These stabilize blood sugar and blunt inflammatory and insulin surges. If you drink coffee, try it without added sugar and consider pairing it with a protein-rich bite. Coffee alone on an empty stomach can amplify catecholamine release in sensitive individuals. Small, practical swaps like these reduce morning metabolic shocks. Medication timing is a conversation to have with your clinician, not a decision to make alone. There is growing research into chronotherapy, the idea that taking certain blood pressure or cardiovascular medicines at night may better control morning surges. Some large studies and trials have explored this, and some guidelines are evolving, but the evidence is not a universal prescription. Importantly, a subgroup of patients called non-dippers do not experience the usual nighttime drop in blood pressure. Non-dippers have higher cardiovascular risk and may benefit from different dosing strategies. The test to diagnose this is ABPM, ambulatory blood pressure monitoring. ABPM is a simple, usually 24-hour test where a cuff measures your blood pressure at regular intervals while you go about your normal day and sleep, giving a true picture of day-night patterns. If you've been told your blood pressure is hard to control, if you snore, wake gasping, or have morning spikes, ask your doctor about ABPM before changing any medication times. Never start, stop, or alter prescription dosing without your clinician's guidance. There are safety implications and individual factors matter. There are special considerations for older adults. Nighttime low blood pressure or nocturnal hypotension can cause falls when standing quickly. For elders with blurred morning vision, imbalance, or a history of falls, the 120-second rule plus bedside slippers and assistance getting up are essential. If medication-related nocturnal dips are suspected, discuss it with your clinician. Do not change pills on your own. Back to emergencies, what should a bystander do? First, call emergency services and scream for help if needed. If the person is conscious but in distress, help them sit comfortably, loosen tight clothing, and reassure them. Have them chew aspirin if appropriate and if they are conscious and not allergic. If the person is unresponsive and not breathing normally, begin CPR immediately. Place your hands in the center of the chest and push hard and fast. Aim for about the tempo of the song Stayin' Alive. If an automated external defibrillator, AED, is available, turn it on and follow the voice prompts. Every minute without circulation increases the risk of death, so a quick response matters. For caregivers, practice your local emergency numbers and the location of AEDs in public spaces you frequent. When you get to the hospital, clinicians will assess you with ECGs, blood tests, and imaging as indicated. Time to treatment matters in limiting heart muscle damage. That is why calling emergency services and getting professional care rather than driving are non-negotiable. A few practical checklist items to incorporate into your bedside routine tonight. Place a filled glass of water where you can reach it. Keep a phone and a list of emergency contacts and medications by the bed. If you live with someone, tell them about your heart risks and what to do if you wake up in distress. Have a pair of slippers on the side of the bed. If you use a CPAP for sleep apnea, make sure it's set up and used nightly. Untreated sleep apnea increases morning cardiovascular risk. We should acknowledge the evolving science. Some trials have suggested potential benefits to shifting the timing of blood pressure meds, and others have raised questions. Studies like Hygia and Time have spurred important discussion, but the final word is still forming. Use these findings as a prompt to consult your clinician and, if recommended, undergo ABPM to personalize any changes. Medicine is increasingly about timing and tailoring therapy to the individual. Your doctor will weigh the risks and benefits for you. One crucial safety reminder: do not self-medicate. If you were prescribed nitroglycerin in the past, you can use it per your prior instructions, but do not start new medications or change doses without medical guidance. Aspirin is commonly advised in emergency guidance, but only if you are not allergic to it and your doctor has not told you to avoid it. Now let me summarize the immediate steps one more time, quick and clear. Call 911. Chew aspirin if not allergic and if advised. Sit or lie down and stay calm. Take nitroglycerin only if previously prescribed. Do not drive yourself to the hospital. If the person becomes unresponsive, begin CPR and use an AED if available. Bystanders, call emergency services first, then begin hands-only CPR if needed. These are the actions that can make a difference in the crucial early minutes. If you have any of the 5 morning warning signs, helmet headache, persistent morning fatigue, loud snoring or suspected sleep apnea, morning nausea that feels different, or sudden facial or leg swelling, make an appointment sooner rather than later. Ask your clinician about ABPM if you have daytime or morning blood pressure spikes, or if you have risk factors like hypertension, diabetes, or obstructive sleep apnea. This video is educational and not a substitute for emergency services or professional medical care. In an emergency, call 911. Before I go, let me be clear. Acting quickly and being prepared matter. Place that glass of water by your bed. Practice the 120-second rule. Wear slippers. Choose a protein plus fiber breakfast. Talk to your doctor about ABPM if you are hypertensive or at increased risk. Teach a family member how to call for help and how to start CPR. These are small steps that can reduce morning vulnerability and ensure that if the worst happens, help arrives fast. If this message resonated, share it with someone who rushes out the door every morning or who sleeps with loud snoring. Subscribe for the next video where I'll walk through 7 foods that may help support healthier arteries and how to include them in realistic meals. I'm Dr. Andre Wambier. Remember the title, Act Fast, What to Do If You Have a Heart Attack in the Morning. Be prepared, be calm, and act promptly when it matters most.